Good morning, Dr. Basha here, founder of Basha Health. Welcome to segment 1 of our thyroid series. Hypothyroidism. What are the signs and symptoms? Weight gain, lethargy, fatigue, depression, cold hands and feet. 75% of our patients are women. It's been my clinical experience that span over 3.5 decades that they're the more intelligent of the two sexes. Sorry, guys. They know when something is wrong. Their internal GPS is off. So they Google their symptoms and they're convinced that they've got hypothyroidism. So what's the next step? They call their doctor's office. It takes between 7 to 10 days to get in for an appointment. And the doctor says, what seems to be the problem? And the patient says, doctor, I feel I've got hypothyroidism. And she tells him the signs and symptoms. And he says 4 magic words. Let's run some tests. They make an appointment for the blood draw. It's at a local facility, LabCorp Quest, that's close to her home. 2 weeks pass by. She doesn't hear from the doctor's office. She calls. She gets the nurse practitioner. What seems to be the problem? She said 2 weeks ago, we had a blood draw for my hypothyroidism and I haven't heard back. Oh, what's your name? Just a moment. The nurse practitioner says, oh yes, we see your results. There's no problem. Well, why didn't you call me? Well, we only call you if there's a problem. There's no problem. Your results are normal. I don't feel normal. I'm frustrated. I want to make an appointment and talk to the doctor direct. Okay. It'll be another 7 to 10 days to get you in. She makes the appointment. She's face to face with the doctor. What seems to be the problem? Doctor, I am convinced I've got the signs and symptoms of hypothyroidism. He looks at the test. He goes, that can't be. Your test results are normal. She goes, I don't feel normal. In a somewhat dismissive tone, he admonishes her and says, nonsense. It's in your head. I feel you're depressed. I am going to make a referral to my friend who's an esteemed psychiatrist in this town. And in all certainty, he will write you a prescription for antidepressants. Stay tuned for part 2.